Well, welcome everyone to the Riordan Clinic Discovering Real Health series. I'm Dr. Ron Hunninghake, and it's my pleasure to welcome our medical director at Overland Park in Kansas City, the Riordan Clinic there. This is Dr. Lucas Timms, and so Dr. Lucas, welcome.
Thanks, Dr. Ron. Good to be joined by you here and to be talking about really a prime sort of pillar to what we do at the Riordan Clinic, which is, like you said, discovering health, helping patients to discover their own health and how to create that health.
Yeah, and I don't know, a lot of these videos will last a long time, and I'm wondering if people will remember what we all went through with the coronavirus, and there's been much discussion about what do you do. Right now we're in the aspect of trying to get people back to work.
Right.
Everyone's worried about will we recreate the virus? Will there be a second wave? And what do we do to prevent that? And there's a lot of talk about drugs and vaccinations and whatnot. But here at Riordan Clinic, we value the ability of the individual to make good lifestyle choices. And so I wanted to just get your input. You're a naturopathic doctor. I wanted to get your input in how lifestyle choices have an impact on the quality of the immune system.
Yeah, it's a great topic. And I think right now, with this whole pandemic, like you said, this might be watched down the road and the pandemic might be long gone. But I think it's important to realize that there's other pandemics going on in our country as well that have been going on for a long time. And those really are pandemics of diet and lifestyle related diseases.
Yeah.
Things like obesity, insulin resistance, metabolic dysfunction, heart disease. These are true pandemics as well. And they're not getting the notoriety of a novel virus, but they really should be, because it's all connected. And I think that what we're learning from this viral pandemic is that if you don't have your house in order, if you're not doing those healthy lifestyle things on a daily basis, if you're not taking care of your body in the right way, you're the one that's going to be most susceptible to becoming hospitalized or even dying from these types of viruses. And whether there's a second wave of this virus or a different virus, something else is going to come along sooner or later. And now's kind of a sort of a wake-up call, I think, for our country to start focusing on preventative measures, diet and lifestyle, because it's really pretty clear that those are our biggest risk factors.
A lot of people think they can kind of indulge in whatever they want to eat, however they want to live their life, and if they do get sick, the medical system will rescue them. But we've seen very clearly, unfortunately, in New York, that the people with the risky lifestyle things that result in obesity, diabetes, hypertension, these are the people that aren't making it. I mean, they're literally dying by the thousands. And so it should be a wake-up call to all of us that the investment we make in a better lifestyle not only is good for us in terms of how we feel right now, today, but it will protect us down the road if there are future waves of this virus heading towards us.
Yeah, well said. I love that. I think that I love the analogy of like a health savings account, and thinking of your health as sort of like making daily deposits into your health savings account so that when something like this does come along, you can weather that storm. And I think a lot of people can relate to that. And so what are the things that we can do on a daily basis that really help to build our immune system and strengthen the foundation so that we can weather the storm? Diet's number one. I think that, there's been a lot of talk around physical and social distancing during this whole pandemic. We should be physically distancing ourselves from all the crap that's in our grocery stores right now.
Yeah.
And so I think that, reducing the amount of processed, refined foods that we're taking in on a daily basis, which makes up a big portion of people's plates these days, unfortunately. That in and of itself, we know that refined sugars severely paralyze the immune system for a number of hours after you eat them. And also contribute to the insulin resistance and metabolic dysfunction and obesity. Of course, things like smoking, sedentary lifestyle, not getting good sleep, depression, not managing your mental, emotional health very well. I think those are all sort of pillars that people, separate deposits or separate accounts they can kind of put deposits in on a daily basis. And, I think if people start with small steps, like just going for walks, like reducing the amount of processed foods they're eating, trying things like meditation or other stress reduction techniques, and looking for ways to improve their sleep, they really can make a huge difference.
I was, you're a naturopathic oncologist, and there's a Dr. Cohen down at MD Anderson that has listed 6 categories that he says improves outcome from cancer, which I think the same thing could be said. It improves outcome or prevents infection because it helps build your immune system. And I think the immunity, the whole immunology feature of cancer control is actually on the rise as well. So having a good, strong immune system prevents cancer. But you know what he said was the #1 lifestyle thing that made a difference in his research was this term connectivity, and how we relate to our family, how we relate to our spouse, our friends, our coworkers, believe it or not, affects your immune system. And so cultivating healthy relationships with the important people in our lives can actually maintain a good immune system. And this, I think that has suffered because people have been forced to stay at home. And if they aren't really working at those relationships, you can get a lot of friction going and a lot of hurt feelings. And this is the dark side of this social distancing and stay at home. And I think this is partly why we're hearing that a lot of people are saying, hey, I need to get back out again. I need to get back to work.
Yeah.
Part of it is they need to spread out a little bit more in a relationship way so that they can get some breathing room in those relationships and revive them and make them healthier again.
Yeah, and I think it's all connected, right? Because if you just take each one of those sort of 6 pillars or 6 concepts of healthy diet and lifestyle that Dr. Cohen talks about, I love that book. They're all important in their own right, but I think when you see the connectivity of all those practices, this is when you really can make some huge differences in people's overall health. Because the mental emotional piece is important, the exercise piece is important, but if you put those together, it's like 1 + 1 = 3.
And if you put 6 of those things together, that adds up to be about 20.
Right.
And so this is the power of synergism. And one of the things when I work with patients, discovering real health is about learning to create synergism between these lifestyle activities. We tend to be very reductionistic in our thinking, like we want the drug, we want the vaccine, we want the magic bullet that's going to solve our epidemic issue. But I think if people would learn how to handle their own lives better by being responsible for their choices and realizing that no one's going to make the choices for them, so there's a self-responsibility feature to healthy living, that this goes a long ways towards improving the immune system without having to get into fancy pharmaceuticals.
100%. But they need guidance, and they need someone who has, training like you and I and all of our practitioners that know how to get them moving down that pathway in the right direction. Because as simple as these things sound, you can get lost. There's a lot of pitfalls along the way and things that patients get hung up on, which they need constant redirectioning until they're able to get that momentum going with their diet and lifestyle, that it kind of becomes more self-perpetuating.
I find that the conversations that we have here at the Riordan Clinic are themselves kind of a catalyst for people to re-examine the choices that they've been making. We get caught in the web of our own past choices, and oftentimes by sitting down with someone who's willing to help that person look at the impact of those choices. This is part of why we do the laboratory testing, because that's an objective measurement about how good you've been eating, how well you've been sleeping, how you've been detoxifying, if that's an important part of what you need to do, avoiding toxins. But having that kind of friendly confrontation with a knowledgeable practitioner can be a wake-up call that inspires people to make those better choices.
Absolutely. And they're not getting it anywhere else, unfortunately. They're not getting it from their, general practitioners anymore. The modern medical system does not really provide a lot of support when it comes to these types of areas of creating health, creating wellness, doing sort of, all the testing and workup that we do that uncovers root problems for patients. And so, we get patients when they come to us, they're already kind of bought in. But I think now with this current pandemic and environment situation we've got, hopefully it'll wake more people up to that. And we need to be even louder with our message now. I think that, now's the time to start getting your house in order, because there will be another wave, whether it's this virus again or another one. And now's the time to start putting those deposits into your health savings account.
And those deposits really can be small steps in the direction of better choices. Everything we do every day is a choice, and becoming better informed, because information will oftentimes motivate us to change, but also having, once again, those relationships that inspire people to be better. And I've always, in looking back on my relationship with Dr. Riordan, he had a charisma about him, but the interesting thing that he emphasized was this concept of co-learners, that even though the doctor may have more education, the patient is, there's an equality there that stems from the fact that we're all trying to do better. Even as physicians, we have to make our own lifestyle choices, and actually physicians are at a fairly high risk rate because of stress and lack of sleep, and maybe not taking time to make good dietary choices. So I have to admit that some of my patients that I've seen kind of put me to shame, because they really do work at taking good care of themselves. And I always like to reinforce that commitment that they have. It makes me think about how I can do better myself.
Yeah, I think, thinking small increments on a daily basis, is a great way to get started. And like you said, a lot of our patients are already well ahead of the game. But, the patients that are already coming to us are the ones I'm not as worried about. It's the ones that don't know about all these things they should be doing. And that's where we really need to get the masses on board and realize that preventative medicine, the best way to treat a disease is to not get it, right? I mean, we want to be thinking more prevention. It's funny when we talk about, you mentioned, of course, I'm a naturopathic oncologist, so most of my work is with cancer patients. And just this past few years, we saw the biggest drop in cancer mortality that we've seen in decades. And really, they were able to pinpoint the huge jump or the huge decrease in mortality to preventative strategies, mainly people stopping smoking. So we've had all these, so-called breakthroughs of drugs and treatments and technologies over the past 30 years, 40, 50 years for cancer patients. But the thing that moved the needle the most was a simple lifestyle change, and having people be more preventative.
Yeah, we're championing this concept of real health, that the real health is the choices you make every day. And it is a process of discovery, because oftentimes we get locked into our perspective that I'm doing the best I can, but you can always do better. There's always something else that could be refined, better food choices, more regular use of exercise activity, going to bed at the same time every night, getting a really good night's sleep, working out those conflicts with people that are important to us, being more open to healthy relationships, and trying to avoid the toxic factors that otherwise pull us down. And there are toxic relationships pull us down.
Yep.
So we can work on all these things and achieve a level of prevention that there's no drug that can equal that.
That's right. That's right, and that's where we need to be emphasizing our efforts and really doubling down right now. The diet is, I would say, the biggest bang for your buck for most patients. That's a great way to start, and also correcting nutrient deficiencies, whether that's via a diet or through supplementation. So when you talk about, our process here, getting patients in, doing the testing to identify those underlying conditions. Of course, exercise, is hugely important. There's, probably the best drug ever invented, regular exercise. And it doesn't need to be, a boot camp style exercise. Really, you need to be moving your body. You need to be getting your heart rate up and improving that oxygen utilization rate, right? Getting the mitochondria the oxygen it needs.
Yeah.
And then, the sleep, the healthy relationships, and the community or connectivity that you talked about. Those are all areas where, if you make these small deposits on a daily basis and are working with someone who can kind of help coach you through how to make that work in a practical manner, I think that's where we'll really move the needle, as far as not just addressing these viral pandemics that pop up every few years, but really the more concerning pandemics for me, which is the chronic diseases.
So, Dr. Lucas, thank you very much, and thank you for your leadership in the Kansas City area. I know a lot of people are looking to you in terms of the naturalistic approach to cancer, but thank you also for just your living the life that we're trying to model for our patients. And for those of you that have looked in on this short little piece, I hope it inspires you to take better care of yourself. You're worth it, as they say in the commercials. You're worth it, but you have to be the one that makes the choices. But we're here at Riordan Clinic to help. RiordanClinic.org it's got a wonderful source of information. We have an opportunity for you to contact each of our doctors on a daily basis if you want to chat with us about what we do here. But the whole idea is to discover real health in your life. So thank you so much for tuning in. Dr. Lucas, thank you, and hope you have a great day.
Thanks, Dr. Ron. You as well.
Take care.